The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, craniofacial and plastic surgeon Dr. David Genikov discusses his detailed and customized approach to rhinoplasty. Bariatric surgeon Dr. Scott Stowers with My Bariatric Solutions helps his patient lose weight. Cosmetic dentist Dr. Guy Lewis talks about his philosophy and approach to practicing dentistry. Clinical psychologist Dr. Collins Hodges discusses how he is able to help families adapt to life changes. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
Before I had the surgery, I was pretty unhappy with my nose. It had a big bump and it kind of was wider on my face. So I knew I wanted to have it when I was like probably hit high school. And so I waited till after I graduated and did it.
So Melanie had a few issues. She had a very broad nose. Both the bone structure as well as the tip were very broad, and the tip of the nose dropped a little bit and was also undefined. So the goal for Melanie's nose was to narrow it, to narrow the tip, to raise the tip, and give her better definition, including straightening the septum internally.
When I initially came to see Dr. Genikov, he took me in for a consultation and he took photos of the side and the frontal view of my nose, and he showed me on the computer what it could look like, and I was pretty happy with what he envisioned for it. Dr. Genikov told me, it was a big decision to make, but he talked me through it, and any questions I had about pain or what it was going to look like, he answered them.
Noses are a little bit different. They require a little bit more time. So when I talk to patients about rhinoplasty, it's important for me to understand what the patient wants. The first thing I do is I sit down and talk to the patient, and I ask them what bothers them. I ask them, kind of what they think they want their nose to look like. Additionally, I ask them if they have any functional problems, breathing problems, if they ever fractured their nose. The other thing that I do, I think, which may be a little bit different, is I do computer imaging after the patient has decided they want an operation. I want to make sure that the patient sees patients of mine, their befores and afters, and kind of sees, that looks like my nose, or that looks like my nose, and I like that result.
Before I got the rhinoplasty, I was definitely self-conscious of my nose, always trying to hide it, and because it was the main focus on my face because it was wider, and after it's definitely balanced out, and so it made me a lot more self-confident.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and a snack at the same time each day.
Trigeminal neuralgia is when an artery or vein presses on the trigeminal nerve. The trigeminal nerve is responsible for most of the sensation of the face and minor movement of two small muscles in the jaw.
My life before having trigeminal neuralgia, I did road cycling, and I would get up and ride 75 miles to 100 miles on a weekend. Now that came to a screeching halt. The feeling I was having was a throbbing pain. It was across my cheekbone. I lived with it for a couple of months. The things that I loved to do before, I couldn't do anymore. Even going up and down the stairs was painful.
Maria's a patient who had long-standing trigeminal neuralgia. She's had it on the order of years, and she managed it for quite some time with multiple medications. The medications over time were becoming less and less effective, and she was having more and more side effects from the medications.
When I first met Dr. Catarini, I was immediately comfortable. He made me feel very at ease. He explained to me what was going on. He had some little models. Once he explained the surgery, it's a little scary because you're going to be going into my head. I'm not one for going under anesthesia. I'm scared of it, and he put me at ease about that.
Because Maria's incision is so small, we were able to cover the bony defect with a small microplate for a cosmetic appearance and for less pain. Success rate for relieving the pain from trigeminal neuralgia from a microvascular decompression is high, in excess of 95%. Maria's returned to normal function and normal work and is off all her preoperative medication.
After the surgery, I was able to just get up and go. There was pain, of course, after the surgery, but not the pain I was feeling with the trigeminal neuralgia. I'm getting back into cycling again and just enjoying my life. Over the past few months, yes, I've enjoyed my life very much.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com. Find your doctor on bestdocsnetwork.com.
At the age of 25, about 15 years ago, I was diagnosed with high blood pressure. And with that high blood pressure came 3 medications. I had a family history of heart disease and had seen a cardiologist since I was 10. Had, just a lot of weight gain with having 2 children. My grandmother had both legs amputated with diabetes. Then my father has diabetes and, just the family history.
Yeah, Lisa is an example of one of our patients that came to see me for the typical problems of inability to lose a significant amount of weight that would affect her health.
Several different doctors for 15, 20 years had been saying that, if you could lose 70 pounds and keep it off, you would get rid of the high blood pressure. There is a huge possibility that you will not be diabetic, that even your heart condition would be just almost completely resolved, and you could even get off of all of the medications. So I chose the gastric sleeve procedure, which for me was just the best choice.
For a sleeve patient, they typically need to be at least 70 pounds overweight. Sleeve is a relatively new procedure that we do where we take out about 80% of the stomach. The whole concept of the surgery is just restrictive in nature, where they essentially are on a low-calorie diet for the rest of their life, but they're not hungry all the time.
I came in, I met with the actual surgeon. I actually sat down with Dr. Stowers, and he was amazing. Somebody who just totally makes you feel comfortable. He answered every question. He was very honest with me and reassuring. It was just beyond belief that he was able to make me feel so comfortable. At 1 week post-op, I was literally off of all of my medications. It had already made that big of a difference.
Within a year, she'd lost about 80 pounds.
I've reached my goal weight. It's been great going from a size 18-20 and an extra large shirt to a size 8-10 and a medium shirt. I never thought I'd see that again, so it's been really exciting.
Josh has a question for Dr. Renaud Rodrigue. What is neuroma?
A neuroma is a nerve tangle, basically. It's something that happens when you've had trauma or surgery where a nerve is trying to get back to its target. So if it's been severed and the nerve is trying to grow back to that target, it doesn't get there because it's interrupted by scar tissue or maybe degenerative changes that occurred in a certain area of the body. And it starts sprouting and forming these little nerve endings that form a little tangle, and it becomes exquisitely tender in some cases. Most typically, neuromas occur in the feet, but they can occur anywhere. They can occur anywhere from your head to your toes. In fact, I don't see a lot in the feet because I think the podiatrists get to those before we do, and they have their own modalities. But we see them from surgery, basically, where there's a scar, and that could be anywhere.
Ask our doctors on bestdocsnetwork.com.
Well, my goal is to give people what they want as much as I can, and usually I can do that. I pretty much have been blessed where I've There's not very many people that say, I can't help you. In fact, I can't really think of anybody. We try to give them a great smile. We do a lot of things that other dentists have told them, well, no, I can't do anything to help you. And I've actually had dentists who refer patients to me, so I'm very honored by that. We try not to just go in and, just do it a cookie cutter type, one size fits all. I try to individualize it for the teeth because I want to be as conservative as I can. I want to do it as comfortably as I can for people, minimal invasion on their tooth structure that's in good shape. So I'm not just trying to talk everybody into doing veneers or doing crowns or whatever. I mean, some people come and want that, and that's fine, but I try to give them options. I try to say, yeah, that is an option, but here's another option, and this might be better for you because ABC. And so we try to work with them and work within their budget and what they can do and what they want to do. What I love about what I do is how it changes people's lives, especially someone who was unhappy with something that had done earlier, that came here to get it fixed. Because they're more desperate sometimes than the people who had anything done. They're disappointed, they're hurt, they were wanting something and they didn't get it. And to be able to take someone like that and to show them it's okay, it can be fixed, it can look fantastic, and to take them and to guide them through that and help them achieve what they wanted to achieve originally and fix it for them is really satisfying. It really makes you feel good about what you're trying to do. I had one guy in with his wife, it's like she won't shut up about her teeth, and she's talking to everybody about it. And so I love that. And getting Facebook posts from patients and talking about how I love my dentist and things like that. I mean, that's awesome. There's a lot of satisfaction in that, and I really enjoy that.
A recent study in the Journal of Periodontology shows that 2 ounces of yogurt a day may protect you from gum disease. The typical container of yogurt holds 6 ounces, and the good bacteria in yogurt helps fight germs in your mouth.
My son was going through a transition of graduating from high school and entering a new chapter in his life. And so I think there was some anxiety on his part. There was some anxiety on my part. It was coming out in negative ways, and we had to identify what's going on. And we needed somebody, an outside person, to kind of help us mediate and facilitate through some of the feelings that were going on.
Alma and Quattro were great. I really enjoyed working with them. They were both very sweet, very bright, very interested in working in therapy. They initially came to see me because Quattro was moving along in his development. He was moving into young adulthood, moving off into college, and part of the conflict there was, what is his move into college and his developmental move into young adulthood mean in terms of the renegotiation of boundaries between mom and son, and then the renegotiation of roles between mom and son.
Dr. Hodges provided a great environment, and he's a facilitator and a mediator, and that's what me and my mom needed in our relationship at the time.
The main change that I saw was a better understanding from each of them as to what their new role was going to be. They both came to a better understanding as to who they were, not only as individuals, but as a close mother and child.
Dr. Hodges gave us some really good guidance and encouragement, and through love and trust, we were able to get through some tough spots and have some success.
After seeing Dr. Hodges, it just gave me and my mom a greater respect for each other as individuals, and just has taught us to learn and grow with each other. Dr. Hodges has helped me realize what progress is and how to obtain it.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Coming up on the second half of today's show, minimally invasive spine surgeon Dr. Douglas Wan talks about an innovative surgical technique he developed called Lumini Microinvasive Surgery. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Interventional cardiologist Dr. Annie Varghese talks about the dangers of heart disease in women, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
At Lumen Health Spine Care, we developed the latest and the most innovative minimally invasive surgical technique, and it is called Lumini Microinvasive Surgery. This is utilizing the most modern technology so that we can preserve all the normal tissues in your spine without creating any kind of damage to your back and without stripping the muscles. We make extremely small incision and go between the muscle fibers with an endoscope to perform the same procedure as if we perform a traditional open back surgery. The big advantage is that the patients are not going to have significant amount of pain. They're not going to have their muscles stripped off their spine, so therefore it minimizes the bleeding, scarring, pain, so that they could recover so much faster. Patients after undergoing Lumini microinvasive surgery are discharged to home on the same day or the very next day, depending on the type of procedure they're having. And many of the patients can return back to work or their light duty activities pretty immediately after the surgery. So we evaluate the patient to see if they're candidate for Lumini microinvasive surgery by having a full consultation and evaluation, and patient may undergo imaging studies or pain mapping process by our interventional pain specialist so that we can clearly identify and accurately identify their pain generator, and so that we can perform the least invasive procedure for the patient. We developed Lumini microinvasive surgery because I personally witnessed it from my father, who had multiple open back surgery. He went through a significant amount of pain, developed chronic pain, and he had a failed back syndrome and lived 30 years of his life with significant amount of pain. And watching him suffer, I realized that we must do something better than what we're doing now to help all those patients with significant amount of back pain and chronic pain. So we used all the latest technology, worked closely with the engineers to develop the least invasive way to approach the spine.
Request an appointment on bestdocsnetwork.com.
I see lots of patients who worry about hair loss. Men worry about that male pattern baldness. There's not a lot you can do about that. The medications we have, both pills and creams, work a little bit, but not great. Women, however, tend to have a problem where they go through these phases where their hair gets really thin, and that can be very, very anxiety-provoking. It is not unusual for the body and the hair follicles to go through phases where sometimes your hair will just be thin for months and months and months, and then it will reset itself. There's nothing you can do about that, really. Also, after you've had a real bad illness, for example, a high fever or some prolonged illness such as pneumonia, sometimes 3 to 6 months later, you, whether you're a man or a woman, may notice that your hair gets thin or you lose a lot of hair. That will be temporary. It's basically related to toxicity from your illness on your hair follicles, causing them to go into a temporary period of time that they don't properly grow. So don't look for all kinds of over-the-counter cures. It's mainly not going to help you. Just give it some time and it'll take care of itself.
I came to see Dr. Liu because I was experiencing intense pain in my legs since I was a little girl. It was hard for me to walk, for me to run. It was just very difficult for me to do normal things that a kid could do.
Emma, when she first came to my office, she was having a lot of complaint of pain to her foot, especially on ambulation. She couldn't walk for very far or stand for prolonged periods of time due to her discomfort. On examination, she was noted to have a severe flat foot deformity. So we tried orthotics, conservative therapy at first. Also, we sent her to therapy to do Achilles stretches. That wasn't working. She continued to complain of pain. So at that point, we had made a decision to reconstruct her flat foot deformity.
When I first met Dr. Liu, he treated me not just like a patient, but more of like a friend, which I never expected that to happen. I expected him to be like, oh yeah, just another patient, you know, never knowing your name, but he's a really good guy.
For Emma's reconstructive surgery, we used 4-web technology for reconstruction of her flat foot deformity. Evan's procedure is basically a cut through the bone, and what we're doing is lengthening the lateral column of the foot itself, because what happens with a flat foot deformity, they have some abduction or adduction of the foot, and what we're trying to do is correct it by pulling it back medial. And by doing that, we're adding an implant into the lateral column of the calcaneus in order to lengthen it. And also what we're doing for a flat foot reconstruction is we're performing a cut at the posterior calcaneus and pushing the heel back underneath the tibia and giving the foot a more anatomical correction.
My life has changed quite a bit. I'm not in nearly as much pain as I was when I was growing up, but I'm still in the road of recovery. Now I'm just trying to get better, and I'm walking around a lot more than I used to. Now I can walk from here to there without having to sit down, and now that I've had the surgeries, I realized that it was probably the best thing that's ever happened to me.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
If you want to have decent hearing when you're in your 90s, you can exercise your ears. Simply turn on some music and practice singling out a single instrument and listening to it. This exercise can help to hear more details in everyday sounds.
Suzanne has a question for Dr. Tim Ragsdale. What are nasal polyps?
Nasal polyps are swollen tissue within the nose that gradually increase over time. They can block the nose and cause obstruction. Nasal polyps are caused by inflammation. Inflammation can come from allergies or sinus problems or other medical problems such as cystic fibrosis. Even aspirin sensitivity can cause the nasal polyps. Nasal polyps usually become a problem when they block the nose or the sinuses. Patients will have problems with nasal congestion or sinus pressure. These nasal polyps can be treated with nasal steroid sprays or steroids by mouth. Some of these patients also need further evaluation and may even need surgery to remove the polyps.
Ask our doctors on bestdocsnetwork.com.
Start sprinkling your oatmeal with some cinnamon. Studies show that this antioxidant-rich spice may reduce blood pressure and lower stress.
I came to see Dr. Varghese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries and a stent had to be implanted. And then reality sunk and
providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time.
Because of her, I'm able to take care of my clients. Because of her, I have a better life. So I really am appreciative of all she has done for me.
Well, coronary disease in women especially is it's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish.
Get at least 7 hours of sleep a night. It will help you live longer, lower your stress, sharpen your memory, and reduce cravings for fattening foods.
Watch more videos on bestdocsnetwork.com.
Oral steroids are administered, they're metabolized, and only very small amounts make it to the target site, and they're short-acting. The reason that we use injectable steroids instead of oral steroids in pain management is because we're able to place the steroids directly at the target site, and the steroids that we use are a depot form, so they tend to stay in place, and all that steroid reaches the target site, so it makes it much more effective, and it works for a much longer time period. Steroids do a couple of things. They reduce inflammation, they work at the top of the inflammatory cascade, and they also reduce the release of some inflammatory mediators which continue to promote inflammation. So they work at a couple different levels. Most patients that come to us, if there's some sort of an inflammatory component to their pain, are candidates for injectable steroids. And that's going to be most people. Whether they have a degenerative component to it or not, most of those people are going to have some inflammation involved with that, and that's how the steroids are going to do their job. Steroids can treat somatic and neuropathic pain. Somatic pain is what we think of as musculoskeletal type of pain. Neuropathic pain is obviously nerve pain. And so often somebody might come with back pain and they have pain going down their legs, so maybe they have some pain in the disc and they have some pain in the nerve. Steroids will work at both levels. Results from injectable steroids take a little bit longer than you see with oral steroids. As I mentioned, oral steroids are quick on, quick off. The injectable steroids take anywhere from 3 to 7 days to reach peak effect, but they're going to be in there lasting and working for you for up to 3 months. In terms of pain from the injection, we use very small needles, and we usually do these under some form of sedation, and so there's very little downtime or pain involved with this.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.